Hello everyone, Dr. Mark Russo, Naples Nephrology. I'd like to go over several questions, or many questions that a lot of our patients ask on a regular basis, the frequently asked questions. First one is that I do get a typical response, or over and over again re-questioning about is, can I get my kidneys better again? My typical response is, well, look at your kidneys as any filter, your gas filter, oil filter, air filter, pool filter. How do you get those filters better? Well, you take them out and clean them. Is there a way to take your kidneys out and clean them or give them a cleaning solution? No, I'm sorry, you can't. Your kidneys are your filters that started with you from birth and will remain with you for the rest of your life. So instead of looking at how do I make my kidney function better, the question really should be, how do I not damage my kidneys any further? And the number one thing is sodium. Stay on a low sodium diet. The less sodium you take in, the better off it is for your kidneys. Good blood pressure control. Some of you have extraordinarily high blood pressures. We need to be more aggressive in managing that blood pressure, getting you closer to a top number or a systolic number of 120. Now remember, we individually treat blood pressure these days, so maybe you've been walking around with systolic blood pressure, or the top number of blood pressure. Maybe you've been walking around with 130 or 140 your entire life, or since you're a teenager, maybe that's normal for you. And so we will specifically discuss that and tailor the blood pressure treatment to those levels. So that's the first question. Another question that I get is, hey doc, I've got kidney trouble. Can I get on the transplant list now? And the answer to that is no. You can only get on the transplant list, you can be evaluated for a kidney transplant when your kidney function gets to 20% or below. So when I tell you it's time to jump, you better jump, because that's when the time is of the essence. We want to burn up that time on the list and not wait until things get really bad, and not wait until you're on dialysis before we send you for transplant evaluation. Can I be on many lists for transplant? That's another question I get. And the answer to that is yes, but I usually suggest doing it in multiple states. If not only here in Florida, maybe somewhere where you've moved from or relocated from, or areas that may not be high in population. After the United Network organ sharing rules came out more than 10 years ago, it tried to level the playing field, but there are some states and some areas that do have a tendency of transplanting individuals before people that are in more populated areas. Are there weight restrictions to kidney transplant? The answer to that is yes. However, there are certain transplant centers in the United States, namely out in Detroit at Henry Ford Clinic and University of Colorado. Those are individual areas that they're starting to do, or they have started to do, laparoscopic transplantation, so weight is not a restriction. That is going to take, that therapy or that surgical procedure is going to take a long period of time before it spreads to many of the other centers, and before it reaches all the centers, before that becomes the norm. So I go back to one of the first things I stated: you got to lose the weight, you got to get it off, and that's what's going to get you higher on the list, or it'll get you on the list, and it'll get you closer to a kidney transplant. Finally, diet. Not only less salt that you take in, but less calories, and exercise. So I know we're going to be asking you to do things that are difficult your entire life, but I think now, clearly now is the time to be extremely serious, because you don't want to be on dialysis. If you're unfortunate and you have to go on dialysis, we'll be talking about the different therapies that are available. And those therapies are as follows. One is home dialysis, or peritoneal dialysis, where you have a catheter in the abdomen. We'll show you pictures, or you could look those pictures up for yourself on the internet. Peritoneal dialysis. We have a catheter inside the abdomen, and fluid sits there for several hours and it empties out. And we use the peritoneal membrane as the dialysis membrane, and that is what helps remove toxins on a daily basis. That's done at home, it's done daily, and there's no blood involved. If you get an infection, it's isolated to your abdominal cavity. It does not go into your bloodstream. It's much, much easier to treat that sort of infection. The other option is hemodialysis. If it's hemodialysis that you choose, if your GFR falls below 20, we'll be asking you to get an access placed. And that access would be a fistula in the arm, and that fistula is where we attach or surgically connect the artery and the vein. And that's to arterialize the vein. We want to make that vein thicker and thicker and thicker. Why? Because if we access that vein on a regular basis that has not been arterialized, that vein will become sclerotic and and clot off and become useless. So therefore, when you attach the artery to the vein becomes much, much stronger. It also grows. So if you look at these pictures, you can just Google AV fistula, and you'll see some pictures of what a fistula looks like, both in cartoon drawings and actual pictures of patients that have a fistula that are just expressing those or displaying them on the internet. The other type of an access is an AV graft. This is a foreign piece of material that can be accessed over and over again. It connects the artery directly to the vein, and the needles that have to be that are utilized to access that material is done 3 days a week, and that's what dialysis usually is, or hemodialysis is usually 3 days a week, 4 hours every treatment. You can also do the hemodialysis at home. That's typically closer to 4 days a week, but you need, and we also always request that you have a support staff individual at home, meaning a spouse, family member, friend that's going to be staying with you and watching that as you're accessing the arm and making sure that no significant problems will occur. Thank you very much. Dr. Mark Russo, Naples Nephrology, saying so long. Any questions that come up, please don't hesitate to ask.